director of NPH Center at Tokyo Neurosurgical Center Hospital. And today I'm going to talk about the treatment of normal pressure hydrocephalus by ventricular atrial shunt. And VA shunt is not popular, but I believe it is safe and effective. As you well know, the treatment on PH has started from this article by Adams and Hakim in 1965. The definition of NPH is quite simple. It is clinical symptoms that can be treated by CSF shunting. The symptoms are gait disturbance, dementia, and urinary incontinence. CT or MRI shows dilated ventricular systems, but the ICP is normal. Gait guidelines for the treatment of INPH are now available.
Excuse me, doctor. We're not seeing your PowerPoint. Did you want to? You wanted to share that, correct?
Share.
Yeah, you need to click the share button.
Share button.
Yeah, to your PowerPoint,
okay.
So we can see it. Yeah. It's a
share.
new technology. We're all learning it.
Share.
Yeah, this just like we did before. Click the share button.
I can't find share button.
Oh, you can't find it now?
I can't find it.
Try moving your mouse and it should appear.
It's appear?
Yeah, move your mouse and you'll see it.
Move
your
mouse
to the bottom of the screen. Move your mouse.
Yes, I'm moving it.
Okay, and
but I can't find it.
You can't find the share button?
I can't find the share button.
You found it before, right? Do you remember you finding it
before? Yeah, Michael do that.
Oh, okay.
Okay, share, okay.
Yeah, that's it.
Okay, it's okay.
There you go. Michael, you did it again.
It's okay?
Yeah, it's better. Now you need to go to your PowerPoint.
Okay, my PowerPoint. Okay, I run it.
Yeah. What you're presenting, yeah.
It's okay?
Yes.
Okay. Yes. The guidelines for the treatment of INPH are now available. The left side is Japanese guideline published in 2004 and revised in 2011. The left side, the right is the international guideline published in 2005. And basic diagnostic procedure are almost the same. And this is the flowchart of the diagnosis and treatment of INPH. This diagnostic procedure can also be applied to secondary NPH. And these are the symptoms of NPH: gait disturbance, dementia, and urinary incontinence. Evans index is the ratio of maximum width of the frontal horns of the lateral ventricle and maximum internal diameter of skull at the same level employed in actual CT or MRI image. This is a disproportionately enlarged subarachnoid space hydrocephalus, a unique configuration of brain in the coronal section of MRI that is believed to be specific to INPH. The treatment of NPH is only CSF shunting. VP shunt and LP shunt are most frequently applied. VA shunt is not so popular. However, VA shunt has many advantages, and I have applied VA shunt to about 1,000 NPH patients. And yes, I believe one of the most important for all of the medical staffs is to know what happens to NPH patient by VA shunt. Therefore, I will show you some representative NPH cases treated by VA shunt and then the long-term outcome. This is a 59 years old man, INPH case with the typical neuroimaging finding. His gait has improved. His cognitive function has also improved to normal level. He was operated on 7 years ago and is still symptoms free. This 81-year-old female Although her neuroimaging findings were not typical for INPH, her gait and cognitive abilities have improved 1 year after, and she's still in good condition 3 years after. MMSE improved, Ribamil test improved. This is a 77 years old female with large CP angle meningioma, and all of her symptoms, such as gait disturbance and dementia, have been attributed to this tumor. However, she became completely normal after VA shunt. She's still leading a normal life 4 years after VA shunt without tumor surgery. And this is a typical case of NPH after SH. She received LP shunt, but not improved. She can still walk 2.5 years after VA shunt. Yeah, she's very good. This is a typical case of NPH after hand injury. When he was 63 years old, he suffered from acute subdural hematoma and traumatic SAH. He was operated on and recovered temporarily. However, he became almost bedridden about 10 months after head injury. He became completely normal by VA shunt, and is still symptom-free 6 years after the shunt. This 72-year female suffered from Lewy body dementia. She was almost bedridden for about 3 years. She improved gradually after VA shunt. She was still improving 3 years after the surgery. Yeah. 1 year and 3 years. This 75 years old man suffered from cerebral infarction. He recovered well, but he complained forgetfulness, and his gait and cognitive function were improved after VA shunt. Well, these NPH cases with cerebral infarction are most easily overlooked because all of their signs and symptoms are attributed to cerebral infarction. I showed you 7 different types of NPH and LP shunt malfunction. As you see, VA shunt has excellent effect for all of these patients. And now I'll show you long-term outcomes of VA shunt for NPH. This is a graphic demonstration of outcome estimated by modified Ranking scale. Up to 4 years, significant improvement was observed. There are only a few diseases and symptoms that can show such dramatic improvement by easy surgery like VA shunt. I will show you surgical treatment of VA shunt, but very shortly, because Dr. Guttari will show the details of VA shunt. The first VA shunt was performed in 1955 for pediatric hydrocephalus. And this is my recent surgery. The basic points are quite the same. So I'll show some complications of VA shunt. We have only 3, the complication out of 940, the very small complications, large 2 hematomas, and this is the infection. We have only 0.6% of shunt infection, and the total infection rate is less than 1%. And there are many chronic subdural hematoma, but most of them need no surgery. Only 2% need surgical investigations. But for these cases, it is not good to remove the VA shunt. This is the large chronic subdural hematoma, but her clinical condition was best when the large chronic subdural hematoma was observed. So this is the conclusion. VA shunt is easy and safe treatment for NPH. VA shunt can be applied for any types of NPH, and long-term outcome is good. Complication rate is very low. And do not overlook NPH or INPH. Thank you. Thank you.
Okay, excellent, Kiyoshi.
Okay.
Thank you very much for being
It's okay.
patient. Thank you very much.